The first keynote speaker is Dr. Raghavendra, Director CCRYN, Ministry of Ayush, New Delhi, and his topic is role of Ayush in integrative oncology.
Very good morning to everyone, and thanks for being here. And today I'm going to share the amount of 40 years of work we have done by integrating yoga into cancer care. I'm also happy to state that most of the work has also gone into guideline documents of ASCO and NCCN and SIO as well. So I'll show you the research which we have done and the evidence for using yoga interventions in cancer. This seems not working. Okay, now it's working, sorry. It just worked. Okay, very important thing before I just go into the presentation. One thing very important is to know is there a relationship between stress and cancer. If you look at the studies done in 1960s and 1970s, a lot of anecdotal evidences were there and a lot of studies were done by various psychologists and psycho-oncologists during that time, where they interviewed a lot of breast cancer patients. And even for that matter, during that time, they said that melancholia or depression is related to breast cancer. They meaning to say that people who had cancer, when you look back at their history, they had negative life events, they had a history of depression, they had negative behaviors. And this is what they're saying, that stress can cause cancer, was what the thing was going on during that time. But there's a lot of bias, because when you go retrospectively and ask the patient, you'll always get some answers which are prone to influence the outcome. So this is the retrospective studies which were done, which had a lot of bias. But a lot of studies also happened in the animal labs, in rat models, in the 1990s especially. And this is one of the first studies which they showed very clearly how chronic stress can really accelerate tumor progression. So when you have a high amount of chronic stress, your HP axis dysregulation happens, high levels of cortisol, high levels of catecholamines, and this can lead to tumorigenesis, neoangiogenesis, as well as low-grade inflammation. And they have shown that it can influence the tumor microenvironment and cause tumor growth and progression. So even though we don't know whether stress can cause cancer, we really know that stress can accelerate the progression of cancer. So how? But these are the pathways which have been done. A lot of studies have been done on this. When a lot of animal model studies using ovarian cancer cell lines inoculated into mouse models, or breast cancer cell lines inoculated into mouse models, lung cancer cell lines inoculated into mouse models, and pancreatic cancer cell lines inoculated into mouse models. There are 4 or 5 big labs in US, including Memorial Sloan Kettering Cancer Center, Mayo Clinic, then Harvard, as well as in MD Anderson. They've been doing a lot of work in this area. And they published a lot of papers to show how psychological stress, restraint stress, okay, and isolation stress can impact cancer progression. And they've done a lot of these studies in animal models. They've shown upregulation of VGF, CAM, PK pathways, increase in M2 macrophages, decrease in cytotoxic activity of T lymphocytes, increase glycolysis, increase lipid synthesis, mitochondrial dysfunction. It is shown to increase metastasis and genomic instability, also to increase chemoresistance and radioresistance in cancer mouse models. Okay. So these are the downregulation of immune dysfunction which occurs with cancer when you have a chronic stress which can lead to tumorigenesis and neoangiogenesis as well. So this is what has been shown. Tumor is a different faculty altogether. It grows with help of stress. Very important understanding. So people thought that if the tumor was highly vascular, the chemotherapy drugs could go into the tumor and kill the tumor. But it was not so. Later on, they realized that the tumor vasculature is abnormal. It forms more of vascular plugs inside, causes areas of ischemia and necrosis inside. And these ischemic areas are the areas where the cancer can really grow fast, develop resistance. And this is a very important thing which happened in the 1990s when they started to unravel the HIVs, hypoxia-inducing factors, which was a stimulating factor for growth of tumorigenesis and neoangiogenesis in tumor cells. And they showed that psychological stress can also activate this VGF pathway. Okay. And this is the first study which was done by Anthony et al. It was published in 2006. The Nature Reviews Cancer. Similar time, it was also published by, this is published by Anil Sood's lab in Memorial Sloan Kettering Cancer Center. We did a lot of studies on mouse models, and they showed that stress can increase tumorigenesis. So what they did was this, they took, sorry, I think I just lost a slide probably. Yeah, see. What they did was they took 4 different groups of mouse. One was a control stress, one was a placebo plus stress, other one was a propranolol, it's a beta blocker basically, and another one is propranolol plus stress. And they showed that the group of mice which had placebo and stress had high levels of tumor over a period of 1 month compared to those which did not, which had a propranolol. So propranolol was blocking the effects of stress. They showed 2 things. You can reduce the stress, you can block the progression of tumor. At the same time, if you increase the stress, it's going to increase the progression of tumor. So very important slide. And after this was followed by another big study by Sandra Septon and colleagues. Okay, so they did, after the mouse model, this is the same mouse model you can see. This is a pancreatic cancer cell line mouse model, and you can see the tumor more, whenever you give constrained stress, whenever you give terrifying noise or inject epinephrine, the tumor load increases significantly. Okay. And this was another study which was done by Sandra Septon. It was published in Journal National Cancer Institute in 2001. She did a very interesting study. She took metastatic breast cancer patients. One group which was clinically depression, had clinical depression. Another group which did not have depression. And she looked at the salivary cortisol, early morning 6 a.m., 9 a.m. and 9 p.m. cortisol. And she showed, and also she looked at NK cell activity and NK cell counts. And what she found out was, patients who had depression had flat cortisol rhythms, okay, had flatter slopes, means not deeper slopes. Usually cortisol is high in the morning, is supposed to steep down by night, so you can sleep peacefully. Okay, but these people had flat slopes. So you can see those with the flat slopes, okay, down. You can see the down one is those with the flat slopes. They had poorer survival time, about 50% lower survival rate as compared to those who had a deeper cortisol slope. So it came on to show very clearly that those who have stress have a faster tumor progression, have poorer survival. Okay? She also linked this to NK cell counts and NK cell activity as well. This is in 2001. So later on, there's another meta-analysis done during the same time, which showed that people who had depression, okay, people who had depression, the mortality rates was 25% higher in people experiencing depressive symptoms, and it was 40% higher than controls who had major depressive disorder. Okay, very important thing. This is a meta-analysis done on all the studies where they are looked at depression in cancer patients and looking at survival outcomes. Okay, so this goes on to say very clearly that stress is a part and it increases the progression of cancer. So we wanted to see what was yoga going to do with respect to stress, and we began our study in 1998. During that time, we didn't have this much kind of trials. You can see all the trials. We started off during 1998. When I started my trial, only 3 studies were there. Okay, 3 to 4 studies were there in yoga and cancer. Okay, but now you have almost around 587 studies. Okay, out of which 52 studies are currently recruiting clinical trials on clinicaltrials.gov. They are just increasing in exponential numbers. Some of the largest clinical trial publications in yoga, the first one is depression with more than 230 publications, clinical trials in yoga. The second one is oncology, 157 clinical trial publications on yoga. Okay, so the large amount of evidence for yoga comes from this particular sector, that is in oncology. Okay, so now you can see in all the major medical teaching hospitals of US, like Osho Center for Integrative Medicine or UCSF School or Mayo Clinic or Harvard or MD Anderson, you have a yoga department, you have a yoga branch. A lot of studies are going on funded by NIH and NCI trying to unravel the effects of yoga in various medical conditions, including oncology. So if you look at the statistics of clinical trials here, it's increasing till now. There were 164 clinical trials ongoing, and there is almost 20% of those publications you see are clinical trials which are already ongoing here, and it's increasing over the years. And these are the clinical trials over time. They're just keeping on, they're just increasing now. A large number of trials are already there. And this is the review which was done on symptom management in breast cancer patients, evidence-based and future directions for research. And in this study review, it looked at all the clinical trials in oncology settings, and most of these were during treatment. Okay, number of things which are during treatment, post-treatment, and combined. And what the most of these studies were looking at was quality of life, self-report questionnaires, physical symptoms, psychological symptoms, objective assessments, psychological and cognitive symptoms, and the same thing was seen in almost both during treatment, pre-treatment, as well as combined as well. Okay. And if you look at symptom burden in cancer patients, this is a distress thermometer. You can see what 90% of the patients have fatigue. You have 60% of them have anemia. 90% have nausea, emesis, and majority also 56% almost have constipation. You have diarrhea, you have cognitive impairment, and so on. Okay, so these people have significant amount of symptom burden, and reducing this symptom is very, very important to reduce distress and improve quality of life. So we did a study where we want to look at using yoga interventions, mind-body intervention basically, to see how we can reduce or bring about symptom control, reduce distress, depression, mood disorders, reduce perceived stress, can it improve immune cell counts, can it reduce inflammation, can it improve anti-tumor immune response, can it reduce cortisol rhythms, can it reduce the DNA damage or genotoxic stress due to radiotherapy and chemotherapy. So these are some of the questions which we wanted to know. And was these going to be affected by using better coping mechanisms in cancer patients or not is what was our question. Okay, so this is the first study which we did, and all these studies are almost 21 peer-reviewed publications have come out of these studies in major journals. And the first study was on breast cancer, stage 1 to 3 breast cancer patients undergoing surgery followed by chemoradiation. Okay, so during those times in the 1990s, mastectomy was the main thing. There's no breast conservation surgery was really not happening in India. So everybody used to do mastectomy during that time. So there should be a lot of image problems, social isolation, lack of self-esteem in these patients. So we looked at how surgery, 4 weeks after surgery, how does it help in improving wound healing, immunity, inflammatory cytokines, and anxiety. During chemotherapy, we looked at mood states, nausea and vomiting, and fatigue. Radiotherapy, we looked at, especially head and neck cancer patients, we also looked at speech articulation, fatigue and myofascial pain in cancer patients. We looked at pain management, immunity, quality of life, and constipation and fatigue in metastatic cancer patients, as well as patients who are in palliative care settings. Okay, so these are different studies. So this is a study which has been published in the Indian Journal of Palliative Care. We looked at yoga program on quality of life and toxicity in breast cancer patients receiving conventional treatment. This is RCT basically, and we showed improvement in all these measures. I'll come to it later on. Okay, and this is the meta-analysis where they have quoted our studies, and you can see here the decrease in the anxiety and depression is almost similar to those which you see in other studies as well. This is by Holger, Kramer et al. And now recent meta-analysis also come where our studies are also being quoted very recently. I have not put that as data as well. Okay. So if you look at fatigue, very important thing, most of the patients complain of fatigue, and this is one thing which doctors don't answer. Fatigue can be due to hyponatremia, can be due to nutritional deficiencies, can be due to the cancer itself, can be due to the low blood counts, can be due to low hemoglobin levels. Okay, it can be due to various causes, and also due to psychological distress as well, and nutritional concerns as well. So this has to be managed efficiently by proper counseling, finding out the problem and addressing the problem, which is really not done. And people also have to be taught about energy conservation, how they can conserve energy, how they can do simple tasks by saving energy. This is very, very important, and we started teaching them yoga intervention by looking at this particular study, and now yoga is a part of the guideline for management of fatigue in breast cancer patients. Okay, and this is what we wanted to look at. We know that yoga can improve oxidation of tissues, it can bring controlled energy expenditure, it can improve good sleep, because if sleep is a problem, you will have fatigue, and it can ensure lesser fatigue because of the isometric stretches which we perform. So this is also a part of the guideline document now in SIO on how yoga can be used in management of fatigue. This other study which we did was stage 2 breast cancer patients undergoing radiotherapy, and one arm received yoga plus radiation, another arm received only radiation. Okay. In this study, we looked at fatigue scale, okay, and we saw the amount of severity of fatigue, the frequency, interference of fatigue in the daily life came down significantly in yoga group. You can see the green one, as compared to controls post-intervention. Okay. We also want to look at the salivary cortisol levels. So we also looked at quality of life levels. Yoga improved emotional function and cognitive function in this group, and it also improved social functioning and global quality of life. So we also want to look at mechanism, and in the same study, 3 days before radiotherapy, 6 a.m., 9 a.m., 9 p.m. for 3 consecutive days before radiation, 3 consecutive days after radiation. we did salivary cortisol levels. 18 vials per patient, okay, for almost around 90 patients we have taken. And we were always sitting in the lab and doing all the days ELISA all the time. Okay, so this is what we saw here in this, and this has been also been published in Indian Journal of Palliative Care as well as Integrative Cancer Therapies. So this is what we saw. The mean cortisol slope, the early morning waking cortisol 6 a.m. was lower in the yoga compared to controls. This is a very important finding because mean cortisol slope, mean levels comes down in the morning. That means they're going to have a better response. Okay, and this has been published in a journal called Integrative Cancer Therapies. Then we also looked at long-term yoga practice on psychological outcomes in breast cancer survivors. My colleague Dr. Amritanshu is going to talk on this. I'll not go into deep details. This is another study which we did in looking at developing a yoga module for chemotherapy-induced nausea vomiting. So we had a 3-arm trial. One, we know very well that when you give chemotherapy, you give antiemetics. Antiemetics are very good for preventing vomiting, but it can cause nausea. It can cause anorexia, loss of appetite. Okay, and this can, because of anorexia, loss of appetite, they won't take proper food. The blood counts are going to come down during chemotherapy. We may have to delay chemotherapy. So we wanted to see how we can solve this problem, because you have a gastroparesis caused due to antiemetics. So we did a 3-arm trial. One arm received yoga intervention for 25 minutes on the bedside. Other arm received Jacobson's relaxation or progressive muscle relaxation on the bedside. And the third arm was a wait-list control. All the 3 groups received moderately emetogenic chemotherapy regimens and the same class of antiemetics. Okay, and what we saw was better domination of the gastric motility, which we did by electrogastrography. We did a water load test with electrogastrogram and to see whether really the gastric motility is changing with yoga intervention. And we saw that change happening by 3rd cycle of chemotherapy. Means repeated practice of yoga during chemotherapy improved the gastric tone. Okay, reduce the feeling of nausea, reduce the feeling of anorexia in this population. Okay, and this also got the ASCO 2013 Conquer Cancer Foundation Merit Award as well. Okay. Okay, and this is another meta-analysis which shows about distress. Again, our studies are shown to be useful here, similar to that of other studies. And this is on post-operative outcomes. We looked at drain retention, duration of hospital stay, interval for suture removal, post-operative complications, post-operative duration and wound healing, and we saw improvement in all of these measures in yoga intervention compared to controls. So yoga group reduced the interval for suture removal by almost 2 days, and it also had earlier discharge from the hospital by almost 1 day. So it also has cost savings for this patient. Okay, and we also looked at natural killer cell counts or NK cell counts before surgery, post-operative, before and after chemo and before and after radiation. And throughout this thing, we saw the yoga group having a higher NK cell count compared to the control group. Okay, and how is this? We want to answer in the next study. We looked at DNA damage by using alkaline gel electrophoresis or Comet assay, and that tail length will tell you amount of DNA which is damaged here. So in both the yoga and control before this, the DNA damage was very less before radiotherapy. After radiotherapy, the DNA damage increased significantly in both the groups. But the amount of DNA damage was lesser in yoga compared to controls, indicating there was better repair capacity of the immune cells or lymphocytes following yoga intervention. This is published in Integrative Cancer Therapies again, which has impact factor of 3. Okay. And now we have integrative therapies during and after breast cancer treatment. We have an endorsement guideline by Society for Integrative Oncology, and I also happen to be the co-chair of the study interest group on yoga at SIO. Okay, and in this we saw the NCCN guidelines. It says you can use yoga if approved by the physician. The first time any yoga has come into the NCCN guideline document here for prevention of nausea and emesis. This is where our study has been quoted in this particular guideline document. Okay, so next is the NCCN cancer-related fatigue guideline. Here too they are talking about using yoga intervention. You have a category 1 evidence for yoga here. Okay, all physically based therapies. Just about that, category 1 evidence is there for yoga here. Okay, then you can look at adult cancer pain here. It talks about imagery, distraction training, relaxation training, cognitive behavior training, etc. And you consider yoga for improving some of our service areas such as distress and pain and cognitive functioning. I'm almost done, sir. And Journal of Clinical Oncology has endorsed this guideline in 2018. And this is what's the key recommendation: use meditation and yoga for anxiety and stress, yoga and massage music therapy for depression, mood disorders, meditation and yoga for quality of life, acupressure, acupuncture, as well as yoga also for chemotherapy-induced nausea and vomiting. Okay, so yoga is recommended for this right now as far as evidence-based guidelines are considered by NCCN, SIO, and ASCO. Okay. So this is what is the evidence level. We have done a lot of work on doing yoga for different modules: headaches, fatigue, neuropathic pain, constipation, insomnia, sleep disorders, etc. We have about 10 in-house research studies since 2007, 35 publications, 16 ASCO abstracts, one ASCO Merit Award, one ESMO podium presentation. We are the first ESMO certified integrative oncology department in the country, certified in the year 2014 at SCG Bangalore Institute of Oncology. Okay, this was the team back then. It's all changed now, and I have come out of the center. So this is a very good team. We had a lot of people there. So we had oncologists, we had palliative medicine specialists, we have yoga therapists.